Hello.
Check, check, check. Okay, I think folks can hear me. Yeah. All right. Good morning, good afternoon. How's everybody doing? I'm getting a thumbs up from Gigi. Is that right, Gigi? Is that how you pronounce your name?
Yes, that is correct.
All right,
Hi.
perfect.
Doing well. Thank you for asking.
Kenyatta, where are you? Where are you located?
In Lexington.
In Lexington. Okay, excellent. Got a few folks joining in. We'll give them a few more minutes.
Hey, John, this is Alicia. Can you hear me?
Yes, ma'am, I sure can.
Oh, great, great.
Hey, have you got a little bit of time that maybe we can connect after this call?
Yeah, sure. That'll work.
Okay, awesome.
Thanks.
Yes, ma'am, thank you. All right, gang. So we've got a few folks on the line with us. I'm sure some others will be joining us, but happy Monday to everyone. For the benefit of Gigi and Kenyatta, this is a call that we do with our Head Start directors across Kentucky. We had previously been doing them every week. We've now changed that to every couple of weeks. And we get, depends on what everyone else has going on. But we get a variety of folks. We've got some folks on here today. We've got Bourbon County and Northern Kentucky and Lake Cumberland and Audubon and Southern Kentucky and Central Kentucky and Middle Kentucky and all sorts of folks that are on here with us today. So a few updates for our Head Start folks. We had a really good board meeting last week. I want to thank everyone for participating in that. Last week, we also conducted our 2021 officer elections for the 3 positions that were open for election. Those were the offices of President, Vice President for Engagement, and Past President. You should have each received an email with the results of those elections on Friday. The results were that Christy Lewis, who had run unopposed for president, was confirmed for president for another 2-year term. That will be her final 2-year term that she's eligible for. In the role of Vice President for Engagement, we had a couple of folks running for that office, and the winner of that race was Jeff Martin with Audubon area. And I want to thank Chris Holliday for stepping forward as well and throwing his hat into the ring. And I know that Chris will be active with us in a variety of other capacities as well. And then finally, in the role of Past President, we had Alicia Polston, who had served previously as a president with KHSA. I know when she had served as Head Start director, and now in her role as executive director of Lake Cumberland Community Action Agency, will be serving on our executive committee as past president for a 2-year term. So congratulations and welcome to all of those folks. We're very excited to have you with us, and a few new folks, at least in terms of folks that I've had the opportunity to work with in terms of our executive committee. I'm excited to work with you. So congratulations to all of those people. We've been talking a lot lately about our new sections and our new standing committees. I'm happy to let folks know that as of this morning, we have stood up officially our very first of those standing committees with our awards committee. And we had a few folks that have expressed keen interest in that. So we have Jeff Martin, Renee Sexton, Missy Saylor, and Kelsey Turley. Those 4 folks will be comprising our awards committee for this cycle. Awards applications are going to be due this Wednesday, June 15th. So they have to be postmarked by then. Hopefully we will receive them by the end of this week. We will then get those out to our awards committee. Our awards committee will then spend the next few weeks reviewing those, getting their choices back to us, and we will then make those awards for the state. But more importantly, we will be sending those nominees on to the Region 4 Head Start Association in order to participate in the regional process, and also hopefully on to the national award ceremony, award selection process with the National Head Start Association. I think, as most folks know, Kentucky did quite well in this last process with the regional level, winning 6 awards. And we hope to do even better this year. So I want to encourage folks, you've got a couple of days left to get those award applications in the mail. If you haven't already done so, I'm going to be checking up on those applications this afternoon, and hopefully we have a big stack of them. So look forward to seeing those. Let's see, a few other things. We're working on getting a few folks to participate with us in future meetings. Sarah Vanover and the folks from KDE, we're going to be getting them on board with us to provide some updates. You will be receiving new invoices for the next fiscal year. Of course, we run on a standard July 1 to June 30 fiscal year. So you will be receiving new dues invoices that will be going out this week. Those will be due starting July 1. So be on the lookout for those in your email. If you have any questions about those, please send me a note. But otherwise, as James noted during our board meeting last week, those will be due on no later than August 30th. Other than that, that is about what we've got and what we've been working on this week. Are there any updates or questions from anyone else? I just want to thank, I see James is on here. James, I haven't had a chance to thank you, but I thought you did a great job during the board meeting last week, stepping in and sort of explaining everything that we had. So thank you for doing that. All right, so this week we have with us a couple of folks. They are with a new program that I think, Kenyatta, is it based out of Lexington? It is? Okay.
The company is in New York, but we have a community here in Kentucky, which I'm going to share with you all about.
So we've got a new program that we think may be of benefit and interest to the Head Start programs across Kentucky. And I'm going to leave it to you guys to tell us about it. It is, let me pull up the email here, United Community. And we have with us Kenyatta Pinkston. Kenyatta reached out to me a week before last, I think. And she also has one of her colleagues, Gigi El Mizrahi, who is with us. And they are going to share with us today a little bit about United Community and many of the programs and offerings that they have that may be able to benefit the students and families that Head Start is serving. So with that, I am going to make both of you a co-host so that you can share your screens and also be in charge of the meeting. So Kenyatta and Gigi, I'm going to turn it over to you.
Thank you so much. I am certainly thankful for this opportunity to come before you all and share with you a resource that I believe in 110%. And just to give you a little bit about my background, my name is Kenyatta, and I am a community engagement manager at Unite Us. And I'm going to tell you a little bit more about Unite Us in just a second. I'm going to share with you some of my background. So I've been in public health for about 19 years. I started at the local level, at the local health department, working with vulnerable and disparate populations, and then advancing to work with health equity, excuse me. From that point on, I transitioned to Community Action Council and was the health and nutrition team leader for the Head Start, Early Head Start and Migrant program. So I know you all know all about that. And then I later advanced my career to work for the Kentucky Department for Public Health, where I planned for vulnerable populations during public health emergencies and disasters, and then went on into some grant management and finance management as well. And so all of my experience has brought me here to Unite Us. And just to share a tidbit of information about Unite Us, because I want to show you a brief video. Unite Us is a technology company. And I know most of you all hear technology company, it's like, oh goodness, what is this? You're going to ask us for money and we have to pay for something. And that is not the case. That's not why I'm here, to get money from you all or anything like that. I simply want to share a resource with you all. Unite Us is a technology company that builds coordinated care networks of health, education, and social providers. They allow these providers to come together on a shared platform to send and receive electronic referrals that allows them to track the journey, the health journey of their clients and families that they serve in our communities. And so I want to share with you all just a little bit about Unite Us. And then at that point, my colleague Gigi, and then Gigi, I would like for you to introduce yourself. Gigi has spearheaded the work here in Kentucky. And I would like for you to introduce yourself, and she's going to actually show you this resource. Okay. So Gigi, you want to introduce yourself?
Sure. Thank you, Kenyatta. Good afternoon, everyone. My name is Gigi. I am the Senior Engagement Manager with Unite Us here in Kentucky. I am based in Louisville. I've been with Unite Us for about a little less than 2 years now. And before that, I worked at the United Way here for about 7 years in the early childhood and youth development space. So just really excited to be here with you all today. Thank you so much for the invitation and the opportunity to share our work with you all today. So looking forward to speaking with you in a few minutes.
Great. So I'm going to share my screen. And then I'm going to share.
We all know how important it is to address people's health and social needs early to improve outcomes. However, today's fragmented landscape of care doesn't always make it easy for people to get help. What if everyone could get the care they need when they need it? And we had the ability to track it all to actually improve the way care is being delivered. No paper referrals, no pamphlets, no missed appointments. That's where Unite Us comes in. At Unite Us, we're transforming the system to ensure that health and social care providers can work together in one network. With our suite of solutions, we've been working hand in hand with local partners to build healthier communities across the country since 2013. How does it work? Anna's story is a great example. This morning, Anna arrived at her local food pantry. She told the staff there that she was struggling to pay her utility bill for that month. After capturing Anna's consent to have her information shared across the Unite Us platform, they immediately referred her to an organization offering income support through Unite Us, and Anna was able to get help that week. Since Anna had already been referred to the food pantry through Unite Us, we located her record, and this referral popped up on her timeline for both organizations to see. Once Anna received money to cover her utilities for the month with the help of her financial assistance provider, the coordinator there securely sent a status update back to the food provider. By working together, they made sure she got the care she needed. Every community is different, which is why Unite Us supports flexible network structures. Our system is always evolving. No matter where we start, our goal is to make sure everyone has access to the network. Unite Us securely tracks every health and social care referral, interaction, and outcome across Anna's care journey. And not just whether a need was addressed or not, but what actually happened. This data allows us to assess what worked and how to improve the quality of care for Anna and people just like her. The impact of our technology depends on the people using it. That's why we have a community engagement team that's dedicated to growing and improving the network and its performance over time. With the data generated by our platform, we can identify what's happening and where there may be gaps in resources. By empowering our partners with these insights, we can better address people's needs and even predict who will need services, when, and where. In time, the community-based organizations can be paid the same way the healthcare system is for the work they do. Anna's story is one of many just like hers. Here at Unite Us, we envision a world of truly connected communities. Join us in getting there, one story at a time.
All right. So now we're going to talk about United Community. We're briefly going to discuss why we're coming together, who's involved, United Community in Action, and do a brief demo of our platform. The video you just saw explained Unite Us overall and how this company ensures that the client or the community members, the focus is put on their specific needs and ensures that those barriers that they need to be connected to a resource is removed. And I'm going to inform you more about that in just a second. United Community. United Community is Unite Us. However, it is very unique to the state of Kentucky. So basically, we call our community United Community. So all of our partners who sign up and are part of Unite Us in Kentucky, they will be under the umbrella of United Community. And as I said before, Unite Us, which is also United Community, is a coordinated care network connecting community partners through a shared technology platform. And these community partners include healthcare providers, government agencies, education agencies, human service organizations, faith-based organizations, etc. And so several of the benefits of the United Community is that agencies are able to make electronic referrals. They don't have to worry about paperwork and ensuring that, paperwork makes it to another location. It's electronic referral system. They're able to securely share client information. So we have some of the most secure, our system is most secure. It's literally an A+ system in regards to securing clients' information. In addition to that, we're able to track outcomes together. So the agency referring a client and the agency receiving the referral, both agencies are able to track the outcomes of that client together. And then it promotes informed community-wide discussion. So those agencies are able to communicate with one another about the needs of the clients. And like I said, this process allows the barriers to be removed from the client and family who needs the resource. All of the responsibility is put on the agency, and it's all electronic, so you don't have to worry about paper referrals. You don't have to worry about anything that may get lost because all of the data is housed in the system securely. United Community, in partnership with Metro United Way, Unite Us is a network of 100+ partners that launched back in April 2019. And it launched in the Jefferson County area, so the Louisville area, and Gigi spearheaded this and has done a lot of work in the Louisville area. And so now United Community has approximately 230 community organizations registered, and we are literally getting agencies registered pretty much on a daily basis. 10,000 referrals have been sent to date. Over 1,000 network users were onboarded. Over 7,000 unique clients were entered into the network, and there's been over 16,000 service needs that have been documented. On April 27th, United Community was launched in the Lexington area, and that's the area that I cover. And so we're building up the network in this Lexington area. However, by the end of August, we expect for United Community to be throughout the entire state, and we hope to have organizations on board in the community as soon as possible, so that we can start strengthening our partnerships with one another and ensuring that the clients and families we serve in our community are getting connected to the resources that they need. We're coming together to connect people to the care they need faster and with fewer barriers. So we know that oftentimes a client just doesn't have the ability to ensure that they make it to the next organization that they referred to. And as I said before, we help them with that process, and it's all done electronically. And one of the benefits is that it strengthens existing partnerships and creates change in our community, because the organizations are able to communicate with one another about the needs of the client. We know that 80% of health happens in the community. And so what I mean by that is that health is much more than going to the doctor's office, going to the hospital, surgeries, etc. Health is also where we live, where we're born, and where we work. Those things can get underneath our skin and disrupt our physiology just as much as viruses and bacteria. So Unite Us allows the client and community member or the families to be connected to other resources outside of just their health medical needs, but also those resources affect those health and medical needs, such as just ensuring that we have the ability to pay utility bills, or to ensure that a person has food, or to ensure that a person, may have job needs. And so we ensure that as we're building the community, that the client has availability or is able to be connected to these resources in their community. And so when you think about it, a lot of times organizations aren't communicating to one another as effectively as they can, especially if, for instance, if a client goes to a doctor's office and they're there for maybe a physical exam, but as they're discussing, some issues with the doctor, they find out maybe they don't have housing, or maybe they don't have food, or maybe they don't have another need outside of a medical need. How does that client get connected to their resource? And so that is what United Community does. It offers an electronic way for providers to easily communicate over a platform about the needs of their clients. Unite Us is a company that promotes health equity and is dedicated to health equity. And so what I mean by this is that Unite Us wants to ensure that everyone has equal access to have optimum health, to achieve optimum health, and that those barriers for them to achieve optimum health is removed. They also understand that this may not necessarily be in the doctor's office, may not necessarily be in the hospital or anything like that. It could simply be a faith-based organization, a barbershop, or a community center or school. Unite Us has over 20 different service types that you can refer a client to. So I'm gonna give you just a few seconds to look over this particular slide so that you can see the 20 different service types that we refer, that organizations have the ability to refer their clients for. In addition to this, each service type has sub-service types. So there's, for instance, for food assistance, underneath food assistance, you also have emergency food assistance. This is just some information in regards to COVID. And so some of the trends we saw is that housing and shelter had a 6,000% increase, income support had a 3,000% increase, utilities over 3,000% increase. Overall, we've seen a 287% increase in electronic referrals for food assistance, income support, and individual and family services. That literally blew my mind when I saw that. So this resource was by far just needed during the pandemic, especially as we weren't able to be face to face. And so it was easy for organizations to make electronic referrals. And then as you saw on the video, this is basically our process. So we have someone who shows up to an agency and they may need, for instance, that let's just say they need food assistance. And so this agency is doing an assessment for food assistance. And then they also found out that this person may also need housing. And so then they say, okay, well, you need housing, we're a food organization, but we're going to connect you to an organization on our platform that is able to provide you with housing. And then that person receives whatever resource that, those housing organizations may have available to them, a resolution happens, and then both organizations are able to follow up on that client to see if the client actually received the service. In addition to this, I also like that this also allows for referrals for organizations to use this platform within their agency. So a lot of organizations, I know you all probably have several different programs in your organizations, and so you can use this platform to refer internally as well. And now I'm going to turn it over to Gigi. I'm going to stop sharing so she can show you our platform.
Thank you, Kenyatta. Before I do that, any questions or thoughts on any of what Kenyatta shared? Any questions about our network so far? All righty. Well, I'm going to go ahead and start sharing my screen. Actually, before I do that, do I have permission to pause the recording as this is proprietary software?
Yeah, that's fine.
Okay, thank you.
I also wanted to mention that it is a great feature even for supervisors. Supervisors are able to assign their staff clients that they want their staff to follow up on, or it's great for like case management, so to speak. So do we have any questions? Is there anything that you all would like to ask us about this resource?
This may be a question that I would ask of some of the folks in the room. How does this, from what you've seen today, how does this compare to some of the tools that Head Start programs or even community action agencies are using right now to track referrals compared to sort of what you've seen today? I'm just sort of curious. And that's sort of an open-ended question to everybody.
Of course, all the community action agencies use the KHSA data system, where they track the referrals that they make for clients and stuff. And also I have, back in May, I received an email from, let's see if I can pull it up real easy here. Let's see. From I think she was in Louisville with Unite Us, and I had sent in the information for when it got up and going for our agency to be a part of it.
Was it me, Alicia?
Let me see. Gail Cummins.
Oh, I got you. Okay. That's amazing. Yeah, Gail is also on our team supporting the Somerset region in Kentucky.
Right. So yeah. So anyway, so I've sent in my information. So we're ready to go. Although that this does look real similar to what we get through the Kentucky Online Gateway, the COG, for staff, or not staff, but for folks that are signing up for Connect insurance benefits. where they can request referrals for other services. And then that generates a referral to our agency. And like I said, it looks really similar to what you all have, where you go in and create the referral and send them the information, and we forward it to the folks on our team.
There are certainly some similarities and then some key differences between the systems. And we are actually in high level conversations with Connect, with Secretary Friedlander's office right now, trying to decide what is the best path to move forward with collaboration between the two systems. So more to come on what that's going to look like here in the coming months.
All right, cool. Any questions? Oh, we've got Gigi and Kenyatta on the phone with us, or on the Zoom with us rather.
I'm sure there may be more of you all who've received emails from us. Like I said, it was Gigi just by herself until about March, and she gained about 4 other staff that are working in the state of Kentucky. We have someone in Northern Kentucky area, the area around Somerset, and also Western Kentucky around the Bowling Green area. And then of course I'm right here in the Lexington area. And so we all were helping with the launch of United Community in the Lexington area when we first came on board. And now everyone is working in their particular areas as well to get community organizations signed up to be a part of the platform. So you all may have seen emails from any of us just trying to get the word out about this resource. And we also we partner with Aetna Better Health of Kentucky. And so a lot of times people want to know, well, how is this so, and so they are one of our partners. And that's how we're able to ensure that for community-based organizations that the resource is free.
Yeah, that was definitely my question in terms of, because you mentioned at the outset, oh, we're not trying to sell you anything. It's like, well, somebody has to pay for it. This is a very robust system. So yeah, that's interesting how you sort of have that model. So yeah, very well could be something that, if you have some additional literature or links or other things, we do have a variety of other Head Start directors from around the state that aren't on the call today. I'd be more than happy to send some additional information out to them. We do make these recordings available on our YouTube channel to folks, although Gigi, as you pointed out, you did have some proprietary stuff there that we didn't record. But if you've got some additional information, we'd be more than happy to send that out to some of the other directors or put you in touch with them.
Thank you. And should I just send all of that information to
you? Yeah, you can just shoot it over to me. I'll be more than happy to share it with everyone.
All right, thank you so much. And also I will have my contact information in that email as well, so that I'll actually put all of our contact information in there and what areas we cover, so that you all, if interested, will be able to reach out to the community engagement manager in your area.
All right, very good.
All right, thank you all so much.
Thank you. All right, gang, any other questions?
Everyone.
Okay, any other comments on other topics? Otherwise, we will adjourn for today, and our next meeting will be on Monday, June 28th. All right, thanks everyone for coming today. Have a good 2 weeks.